Hello everyone, my name is Karina Rojas, and today I want to share with you my journey working on antimicrobial resistance. I have named this presentation Putting One Health into Practice to Tackle AMR. As we know, the One Health approach is the most accepted approach to try to understand and try to do some actions regarding this public health problem. So I really wanted to start this presentation and this presentation of my journey with this picture. That's me in 2015. My background is in medical anthropology. So back in the day, I used to work with indigenous communities of the Amazon region. The most important learning that I got from those years and what really impressed me while working in this context, that was the understanding of the health phenomena as an holistic matter. For indigenous communities, it was very easy to understand and very easy to practice to participate in the idea of taking care of the environment or taking care of the place they inhabit or the animals that surround them was also taking care of their own health. So this really approached me to an idea of health as a connected phenomena, which involved not only the human but also animal or the environmental health. So yeah, after this, I specialized myself in public health. And of course, I got in contact with the topic of antimicrobial resistance, where I got very interested in. And the reason that I really like AMR is the following. So yeah, you're wondering why AMR. There's many things that we need to know about this. The mainstream stuff is that, of course, microbes know no borders, and currently antimicrobial resistance is actually a silent pandemic. AMR, as I am showing here, is already responsible of 1.27 million deaths worldwide, and it contributes to nearly 5 million more. So AMR is actually a very concerning topic. It's something that is not that popular in comparison to other public health challenges, but it's indeed something that it's rising on a rise, and it's of course very concerning. Also, it's important to understand that AMR is an indicator of health inequity. For instance, this is related to access to education, access to medicaments, to pollution. So I think this is an interesting topic just to reflect on how inequities might be impacting health or might be the cause of the cause. So in this case, in this line, I thought AMR is an important topic, but also there are other things that we need to know about AMR that are maybe not so mainstream. First of all, antimicrobial resistance is posing a conceptual shift. As we know, AMR is also an indicator of anthropogenic actions impacting planetary health. This means that actions driven by humans, by the population, are actually impacting on animal health and on the environment, and it's causing different, it's causing problems such as AMR that actually end up impacting on us. So this is very important, a very important thing to take into account. Also, I noted that AMR is clear as mud, meaning that this is such a complicated topic to communicate and to transmit. Actually, it's a very technical topic, so even within the professionals that work in this area, it's hard to reach a common ground. This is why AMR is challenging, and also this is why interesting to me. Given that I come from social science, I think my field has a lot to bring on the table for this. And also AMR caught my attention because it's a highly political topic. It's of course related strongly to commercial determinants of health. It also bring the attention on actually watching and actually caring for how hierarchies within health sectors might be impacting policy making, might be impacting how we understand and how we can improve health. AMR is one of the few topics that actually make dialogue different health sectors, and it's interesting to start understanding to me the dynamics of power that are around that. And of course, it's also a window to system thinking approaches and breaking silos. So yeah, also as part of my experience, I got in contact with the One Health approach, and you might be wondering what is One Health, no? So yeah, as I mentioned here, in the past 10 years, AMR has been reframed under the One Health approach. And this is an approach that recognizes the interplay between human, animal, plant, and environmental health, and advocates for intersectoral collaboration to tackle global issues. This might sound a bit technical or a bit not that clear, but in the end, the One Health approach advocates for the connection of all type of health, just to understanding as the name says, as a one thing, as a one united dialoguing interplay of factors that actually compound health. And of course, I noted here that the multifaceted nature of AMR demands a departure from silo perspective toward interdisciplinary One Health collaboration and system thinking. AMR is actually a subject that pushes us to break silos and to get out of the comfort zone of our own professions, to enter actually in dialogue with other professions. So while approaching to this topic, I had the experience. Well, I had the chance to participate in two particular experiences. I will talk about that on the next slide, and also something that I wanted to quickly note here, that is that in practice, putting One Health into practice is actually very challenging, because why? Collaboration is hard. Collaboration means dealing with diversity. It has when a topic actually involves different sectors, that means that there is a lot of different languages and different challenges that we really need to start working on and try to find a common ground to actually be in synergy of what we want and what we want to aim. And of course, I noted here that the One Health approach is also a perspective that comes from the European and the global North, and in other contexts might be challenging to apply or might be absolutely different. For instance, in countries such as the one I come, that it's from Peru. So this is something I think is also important to note here. And here I cite this study that's called "Enables Study on the Barriers to Effective Development and Implementation of National Policy on AMR." And this report was very interesting to me, because it notes all the challenges that are actually, especially in the policy making part, and especially in the building of, for instance, actions such as the national action plans on this topic. So I think this also give us a food for thoughts concerning AMR. So yeah, now going back to the experience that I had approaching these topics. One is AMR reduction, also called Proyecto Multiresistencias, because this was developed in Spain. And the second one is the EOGM right, which is the European Joint Action on Antimicrobial Resistance and Healthcare Associated Infections, which is my current job, and which was the place where I did my internship for the master's. So in the case of Proyecto Multiresistencias, the way I perceived that me and the team were actually practicing the One Health approach was in the first intake with this. We tried to build a virtual platform with insights coming from the target population. That means that we interview medical residents and the Andalusian population to try to build a platform to approach the AMR topic to their knowledge, to the experience, and to facilitate the gap between information. We create this website that it's called AMR Reduction. The learnings of working in this experience was how important it is to tailor actions to actually tackle problems such as AMR, Also, it taught me really a lot to look for synergies in languages and working style. In this group, we were a biologist, we were a medical resident. There was a there were two medical residents, and my other the other team member was from health science, and I was a medical anthropologist. So it was very interesting just to try to get a synergy in between all of these professions and all these different languages. And of course, this also taught me that actually applying One Health, it's more about turning very highly adaptive and flexible, and to learn how to manage different challenges and different things that might come across the way. The second experience and where I did my internship, as I mentioned, is the AUGen, right? In here, I developed a thesis that it's called Enablers and Barriers for One Health Collaboration AMR and Action Plans. And the outcome of this study is a policy brief that it's called One Size Does Not Fit All, meaning that the application of the One Health approach on the national action plans actually requires tailoring the actions, and actually requires getting to know the context and the diversity of the different countries to start actually applying interdisciplinary and intersectoral collaboration perspectives. So yeah, it was very interesting. Also, it taught me about applying One Health requires a lot of humility, and also requires and then it also told me that in this perspective, it still requires a decolonizing perspective of the issue that might be on the AMR as an issue.
Some final remarks that I wanted to make regarding this experience are the following: is that One Health into practice is the alignment of many things. It starts with collaborative capacity, soft skills, capacity building that needs to be fostered. With interpersonal relationship and networks. It's so important to the community work. It's so important to work collectively to actually produce successful action for in the One Health approach. That also requires a structural and institutional conditions to be applied, because if we don't have these structural conditions, it's very hard to find to foster an initiative that actually works. So it's the liminal of these factors that actually, in my case, in my point of view, actually produces the One Healthness, no? And also another reflection is that it's not about doing One Health, it's about being One Health, no? It's not about trying to apply this perspective, but it's also about opening our minds, our hearts, ourselves to new perspective, to new languages, to new professions, to new ways of understanding the world, to actually work collaboratively and to actually produce concrete actions, no? So yeah, I think this is all the presentations. I really wanted to invite you to follow the Proyecto Multiresistencias. This is the QR for the Instagram. Here's my QR of LinkedIn if anyone wants to share this topic with me. And also, I really wanted to invite you all to follow the AUGen Right newsletter that I'm going to show you here, if I can. Wait, it's here. That I want to show here. It's a very interesting newsletter where we curate these different actions regarding health and policy news, scientific publications, political reports, and everything. It's such a great, such a difficult work to do, but we do the work. So please follow it. So yeah, I think that would be my presentation. Thank you.
Thank you so much, Karina. That was amazing. We are One Health. We have to be One Health. Yes, claps, claps, claps. Thank you so much for the presentation. I want to open the floor now to anyone that may have any questions. And while we're waiting on questions to roll in, Karina, if you want to put any links in the chat so that people can open them in the meantime. So opening the floor, if there's any questions for Karina. You're getting some love from the chat. Hey, Sua. Through your question, Karina, while we're waiting for people to put their thinking caps on. So you mentioned that there's a political aspect of AMR action plans. Do you want to expound a bit on that? Why is it such a political, controversial thing to talk about and introduce?
Yeah, sure. It's basically because I think doing public health in general terms, but especially AMR, it's a field of evil words. It's a field where where we actually need to deal with people thinking that hierarchies need to be let's say the word's not respected, but that hierarchies need to be maintained all the time. But and I think it's a matter of being very flexible and be very open-minded to try to reframe that. No, I think especially for doctors, it's very hard to accept maybe. Well, I don't want to generalize, no, but it's sometimes very hard to accept other type of perspective, other styles of doing things. So yeah, I think we are in this work of trying to align and trying to generate respectful environments for working, right?
Thank you so much. You've got a question from Cecilia in the chat. Cecilia, do you want to hop on and read it, or? Okay, Cecilia asked, did you get any results with your project, something that can be measured? She's mentioning that it's very important, but very difficult to explain.
Yeah. You mean with the Proyecto Multiresistencias or with which one? Or maybe both of you want to well for the moment we just launched the website, and that's been that has took all our vital energy. So I think our next step is actually thinking how we want to measure. Actually, in the beginning, when we build an action plan for this project, we'd actually consider the metrics of our websites and possible interventions as a way to measure the impacts of the project. But I think for now it's too soon because we just launched our platform last week. But yeah, we're looking for we're looking forward to actually obtain a lot of results. We are receiving the love of people. We are receiving messages of medical residents' interest in the project. People actually interest in what we have done. So yeah, and I think we are also looking for continuity of this project, especially in the case of students in Granada. So if anyone interested, please hit us up. So yeah, I think I will leave there.
Thank you. We've got another question from Carlos, and then after this question, we are going to move on to our second speaker. But Carlos asked, what is your opinion toward political will to act on AMR?
Yeah, political will is very important. It's something that I talk a lot with policymakers, especially, well, in the case of Europe. I think we can trace distance, no? Because in the case of, for instance, at least in my country, in Latin America, political will is such an important thing before doing anything, no? Even in many initiatives, they are not performed when there's not political will at all. But in the case of, at least in the case of Europe, political will was an important thing, but more important was well, it's more like a circle. No, more important was budgeting. So political will fosters budgeting, and budgeting fosters action. So it's of course very important, and I think most of the policymakers I talk with, they refer that rather than in the inner political settings, they needed actually the European Commission to take more actions into that to foster to foster the One Health approach and the actions on AMR.
Hey, thank you so much, Karina, for your presentation and for answering those questions. You do have some requests in the chat to send over the link to subscribe to the newsletter. So if you can take a look at that. I also want to let everyone know that there is a sign-in sheet. As Bonnie mentioned before, if you've attended 2 of our talks, you'll be able to get a certification that you were a part of EPHSA in these talks this year. So make sure that you take a moment to do that. Now, I would like to go ahead and move forward with our second speaker, Ms. Katharina. Katharina Sophia Fritsch is a Europubhealth Master's candidate that's currently specializing in public health governance, as well as leadership in Maastricht University. She has a strong focus on antimicrobial resistance and will complete her master's thesis placement with the German Federal Ministry of Health, AMR, and One Health Unit. Katharina has conducted research on barriers and facilitators to AMR research and development in the European Union and actively supported the AMR reduction project, Proyecto Multiresistencias, along with Karina. And her work emphasizes the importance of innovative solutions to combat AMR, lending her expertise in policy, research, and interdisciplinary collaboration. Without further ado, Kata, you may take the floor.
Hi everyone, so let me share my screen. Funnily enough, I used the same template as Karina, but wait, let's see. Do you see my screen?
Do you see it?
Okay, perfect. So hello everyone, my name is Kata, and as Courtney said, I'm a current student of the program, and I did my first year in Sheffield, and now I'm in Maastricht for my second year. And today I'm very excited to talk about a topic that is not only critical but also very close to my heart, antimicrobial resistance. I think Bonnie, Courtney, and some of you here can confirm that I'm always eager to discuss this important global health issue. So I'm really excited that AMR is the focus of this month's EPHSA talk. And I also wanted to mention that last week marked two significant events in the fight against antimicrobial resistance. So it was the World Antimicrobial Awareness Week and the European Antibiotic Awareness Day. And this is also kind of why we thought of having the EPHSA talk on this topic this month. So these global and regional initiatives aim to raise awareness about the proper use of antimicrobials and also highlight the urgent need to address AMR through coordinated actions. And this year's theme was Educate, Advocate, Act Now. So I think this really emphasizes the power of knowledge, which also Karina mentioned in her talk, advocacy, and also immediate action in combating AMR. And I think as students, but also as public health professionals and advocates, we each have a role to play in ensuring that antibiotics and other antimicrobials remain effective for future generations. And with these kind of key messages in mind, today's talk aligns again perfectly with these awareness efforts. And I want to focus on my own research in this area, specifically my bachelor's thesis, which centered on the barriers and facilitators of antimicrobial resistance research and development within the EU. And this slide kind of gives an overview of the conceptual framework I developed, and I explore these factors in more detail, showcasing both barriers and facilitators. So let's take a closer look at the barriers to antimicrobial resistance research and development, which is quite a mouthful, which I outlined in my framework. And these can be grouped into four main categories. And we can start with the first one on economic barriers. So in general, there is a lack of profitability. So there's low return of investment for antimicrobial development due to high costs involved and also low revenues. And these high costs include costs of clinical trials and marketing authorizations and also manufacturing, which remain expensive. And also there's insufficient funding allocated to research. And there are also significant market challenges. So there are a lot of generic alternatives and low prices dominate the market. And this combined with the high profitability of treatments for non-communicable diseases diverts industry interest, of course. So there is kind of an unclear market potential of new antimicrobials, which discourages innovation. And this is also kind of a paradox of antimicrobial use. So effective stewardship of antimicrobials requires responsible use to minimize resistance, but this also limits profitability for the pharma industry. So essentially, restricted consumption conflicts with the industry's interests and need for sales. So this is kind of the main issue. And also, EU member states often cite the lack of adequate financial incentives as a key barrier to EMA R&D, and large pharma, big pharma has increasingly retreated from the market due to low profitability, as I said. However, there's also other barriers, such as the regulatory barriers. These barriers often delay and complicate the development and market entry of new antimicrobials. So there's a complex approval process. There are limited innovation incentives and also stringent clinical trial requirements, which make it really difficult for many novel therapies to meet approval criteria. And then there's also regulatory uncertainty for novel therapies as well. Then I also identified some scientific barriers, which highlight the complexity and resource constraints that kind of limit the progress in the field of AMR. So we have biological complexity, so that basically bacteria and other microbes are ever evolving, and resistance mechanisms of pathogens make developing effective antimicrobials incredibly difficult. And this complexity contributes to the high failure rates seen in research and development. Also, in general, we have drug discovery challenges. So alarmingly, no new antibiotic classes have been discovered since the 1980s. And this stagnation in innovation leaves us vulnerable to resistance strains. There's also significant preclinical and clinical development hurdles. And in general, there's limited resources and expertise. So it's estimated that only around 500 scientists are actively working on AMR R&D worldwide. So this shortage of expertise and resources really slows down the pace of discovery and development. And then talking about collaboration, so also Karina was talking about this in her talk. So there's quite some barriers in this field. So we have a lack of networks and also cross-sectoral collaboration. So AMR, as Karina outlined, spans across human, animal, and environmental health, but the lack of well-established networks really limits the ability to address AMR through this One Health approach. And also collaboration between sectors often remains fragmented. And this is due to barriers to communication and also understanding. So the different sectors often use different terminologies, have different priorities and also approaches. And this kind of lack of a common understanding and communication can really slow down progress, which also Karina mentioned earlier. And in general, there's for now quite an inadequate leadership and understanding of the One Health approach in general. Because leaders have limited knowledge of One Health in policy making, and without a clear commitment to really integrate this perspective, cross-sectoral efforts remain insufficient. But after discussing all of these barriers, let's maybe shift our focus to factors that can help drive progress in AMR R&D. And these are the facilitators that I've identified. And again, starting with more the economic aspect. So financial incentives are key facilitators in addressing the economic barriers to AMR R&D. They work by reducing costs and also risk, or increasing rewards for pharma companies and researchers. And these incentives can be broadly categorized into two types. So on one hand, we have push incentives. So these aim to reduce the upfront costs of research and development, and they provide financial or resource support during the early stages of the development process. An example of this would be grants and subsidies, so funding from governance or organization, and specifically an example for this is the EU Horizon Europe grant for AMR innovation. And then we also have pull incentives, which focus on rewarding successful outcomes by ensuring a predictable financial return once a product is developed and has entered the market. And one example is a market entry reward where companies receive large one-time payments for successfully bringing a new antibiotic to the market. And by combining push and pull mechanisms, we can create balanced incentive structures that really support innovation while mitigating financial risk for companies, which are unfortunately needed or fortunately needed for developing new antibiotics and other antimicrobials. And then another facilitator is public funding and public-private partnerships. So public funding comes, again, as I said earlier, from government agencies or public institutions to support research, innovation, and development in AMR R&D. And a great example, again, is the EU Horizon Europe grants, which provide financial support to researchers who work in AMR. And then we also have public-private partnerships, which involve collaborations between public institutions and private organizations, such as pharma or biotech firms. And these partnerships combine resources, expertise, and shared goals to drive innovation. And one example of this is the Innovative Medicines Initiatives, which is co-funded by the Commission, but also by EPHSA, which is the European Federation of Pharmaceutical Industries and Associations, I think. And this is an example of public-private partnerships. Then again, this comes back to Karina's talk. So really cross-sectoral collaboration, also the integration of a One Health approach and effective coordination are really essential components for advancing AMR R&D. So regarding collaboration and coordination, so it's really important that global efforts are unified to reduce fragmentation and ensuring that resources are really effectively utilized. And by coordinating policies and also strategies across nations, we can streamline activities in the fight against AMR. Then integrating a One Health approach really emphasizes, again, the interconnectedness of health. It allows for the setting of global priorities, maximizing the impact of research and avoiding, again, duplication of efforts. And AMR solutions are more effective when they address all of these sectors. And then also multi-level and multi-stakeholder models are necessary for promoting innovative and sustainable solutions. So we really need to engage diverse actors from governance, but also private organizations to really ensure coordinated response to AMR. So all of these strategies, when implemented together, maximize impact, streamlining global efforts, and really addressing the complexities of AMR across the different health sectors. And this highlights the importance of collaboration at all levels, from local to global, to really effectively combat AMR. Then in general, also obviously supporting science and technology play a crucial role in addressing AMR by driving innovation and providing the tools necessary for effective solutions. So we have technological advancements, so genomics, bioinformatics, AI really help improve our understanding of bacterial pathogenesis and resistance mechanisms. And also diversified R&D approaches can be supportive, so focusing on resistance across different pathogens and also microbiological mechanisms ensure that we address the wide-ranging and evolving nature of AMR. And then again, continuous investment in scientific advancement and technology development is really essential. And then lastly, I also wanted to quickly talk about small and medium-sized enterprises, which are kind of key innovators in the field of AMR. So in 2018, SMEs were responsible for developing 95% of new antibiotics in clinical development. And they excel in focusing on high risk and early stage R&D, where innovation is most urgently needed. and they're stepping kind of into spaces that big pharma often avoid due to the issues that I talked about earlier in the talk. So it's kind of essential to also support SMEs in the field of AMR R&D because they're critical drivers in innovation, but they do face challenges such as the limited resources and funding gaps. Yeah, so these were kind of the main facilitators. And to wrap up, I show this conceptual framework again. So on the left, we have the barriers that I talked about. So we have economic barriers, such as the lack of profitability and high R&D costs, regulatory hurdles that delay approvals and discourage innovation, scientific challenges like biological complexity of resistance, and also barriers to collaboration, highlighting the need for a unified approach. And then on the right, we have financial incentives such as pull and push mechanisms, support for science and advancing technology, enabling innovation, public funding, and also public-private partnerships, which combine resources for impact, but also cross-sectoral collaboration and the One Health approach, uniting the health sectors and small and medium-sized enterprises, which lead in early-stage innovation and high-risk development. So this is just to wrap up this part of the talk. But then I also wanted to have this slide on why AMR matters to all public health professionals. So I really wanted to highlight that AMR is not just a concern for infectious disease specialists, it's also a critical issue that impacts all public health professionals. So it has an impact beyond infectious diseases. So AMR really threatens the success of modern medicine. It undermines the safety of surgery, cancer treatments, and the management of chronic diseases, but also has significant implications for maternal and child health, where infections play a major role in outcomes. Then also the One Health relevance, like AMR really exemplifies the interconnectedness of the health sectors, and addressing AMR requires a holistic One Health approach to protect all these areas and prevent cross-sectoral spillover of resistance. And then also more broadly, it has implications for health systems because of rising healthcare costs due to resistant infections, strain already overburdened systems. And AMR exacerbates health inequities and poses a serious threat to global health security, also by undermining, for example, pandemic preparedness and response capabilities. So just in general, AMR is really a cross-cutting issue that aligns also with SDG 3. And I think all public health professionals need to work together to address this challenge and also know about it. So this is the end of my talk. So thank you for listening. And yeah, if you have any questions, you can put them in the chat or also reach out to me via email or my LinkedIn.
Thank you so much, Kata, for such an informative as well as encouraging talk, because it really is important that we all are collaborative in this public health field. So thank you so much. Amazing. Thank you guys all for hanging in there. So we still got the number of participants that we started this talk with, so very good across the board. If anyone has any questions for Kata, as she mentioned, feel free to turn your mic on or answer and ask the question in the chat. Leave that open for a second. And while we are preparing for those questions, we do have a woo clap for you guys just to test your knowledge a bit, as well as get everyone a bit involved, rounding out this EPHSA talk for today. Manu is going to be leading the section of the talk today. So Manu, if you want to get that prepped and send the link in the chat. And questions are open. And Manu, you can go ahead.
Absolutely. Hi, guys. So just to round out the end of our presentation, we have a little woo clap that has some new information, but also allows you to see how much you've learned from these talks. So I will go ahead and paste the link in the chat. And let me know if there are any problems with it, and then I will share my screen, and there will be a QR code for you to use as well. All right. Is that visible?
Now it is.
Yes. Okay, awesome. Perfect. give you guys a few minutes to log on and then we can get started.
Thank you, Omar, for that hyperlink. Good, everyone, just a couple more seconds. I know that it's Wednesday evening. We really appreciate you guys staying on and participating. Let's see.
I think maybe not counting me, I think we should be good to go, right?
Okay, go ahead.
Okay, awesome. First question. True or false? Antibiotics can treat colds, influenza, and COVID-19.
We're getting some bias here with seeing the results on you.
Oh, yeah, there's a way I can. Oh, there we go. Perfect.
Waiting on a few responses.
You guys one more minute and then we can see the right answer. All right, so let's go ahead and see what we have here. So the correct answer, as the majority of you got, is false. And so this is because colds, influenza, and COVID-19 are caused by viruses. Antibiotics actually treat infections, bacterial infections. Awesome. Okay, next question. True or false? More antibiotics have been produced in the past 30 years than in years prior. Alrighty, one more minute and then we can look at the right answer. For the sake of time, I'll go ahead and I will show what we have here. Yes, that's actually false. So this was actually something I was surprised to learn about. We haven't really been producing that many new antibiotics in the past 30 years. And so as Kata mentioned, that's something that a lot of these middle enterprises are working on. So we'll see how things go in the future. On to the next question. All right. Approximately how many deaths did AMR cause directly in 2019? Let's take a look at what you all answered. Yeah, 1.27 million. So 4.95 million is actually the total number of deaths that were directly and indirectly caused by AMR. All right, next question. What is the estimated increase in global healthcare costs in 2050 due to AMR? All right, let's take a look at the answers. Yeah, the majority of you are right. 1 trillion US dollars are estimated. So hopefully we could do some work towards addressing AMR to hopefully bring that cost down. All right, next question. In the US, approximately what % of antibiotic prescriptions were unnecessary? All right, let's take a look at the answers, see what we have. Yep, you guys are right. Unfortunately, 1/3 of antibiotic prescriptions in the US were unnecessary. All right, next question. Actually, let's go ahead. And in what year was the Global Action Plan on Antimicrobial Resistance adopted by countries at the World Health Assembly? All right, let's take a look and see what you guys are thinking. All right, and yeah, again, you got the majority of you got it right. It's been a little under 10 years since the Global Action Plan on Microbial Resistance was adopted at the World Health Assembly. Which methods can be used to approach AMR and prevent AMR-related deaths? So for this one, you can actually pick multiple options. All right, let's take a look at what you guys guessed. This one was a little trickier. All right. Awesome. Great job. Yeah, so there are multiple different approaches that can be used to tackle AMR, but these are kind of the three main ways that are highlighted to and have been shown to be effective in preventing AMR-related deaths. All right, and finally, what % of the world's population lives in a country with a finalized or provisional action plan for antimicrobial resistance? All right, let's see what you guys think. So actually, 95%. So this is hopefully a really good sign that we can make progress really soon with AMR, and that we can have increased international collaboration on this issue. So that concludes the Kahoot. I will stop sharing and I'll hand it over to Courtney.
Thank you so much, Manu. You were grilling us with those questions a little bit. We love it though, because it really encourages us to engage with the speakers, and there was so much great information in this talk that I think is a lovely way to wrap this up. I do know that we are a little bit over at 7:05. We did receive 2 late questions, one for Karina and one for Kata. I'll read it out from the chat. Kata, I'll start with you first, and then we'll go ahead and conclude this talk for today. So for Kata, do you think low and middle income countries should have different ways of tackling AMR?
Yes, I think LMICs should adopt more tailored strategies to tackle AMR, because they face unique challenges such as limited resources, and they also have more of like a dual issue of antibiotic overuse, but also lack of access to antibiotics as well, which makes the problem even more challenging in LMIC settings. And in general, also there more generally speaking, less resources in the healthcare system. And I think solutions should prioritize cost-effective measures such as better hygiene and also infection prevention and control, and regulating antibiotic sales, also surveillance, and also balancing it with stewardship. But yes, in short, I think these strategies for LMICs would have to be context specific, but that's more general as well.
Thank you, Kata. And lastly, for Karina, how would you encourage other public health professionals to work on AMR? You did mention that it's not the sexiest topic right now in the world of public health, but We do care. You guys have given us such a great talk, so would love to hear your input there.
I don't actually have an answer. I think if you want to be hipster, then go to AMR. No, it's just more like, I think AMR is a topic that welcomes all. So I think it's very interesting because AMR and One Health is a topic that actually welcomes all, the majority of professions. So if you are interested in working in interdisciplinarity, and also if you are interested in working with approaches that decenter the human health from understanding health, then this is your field. No, I think that's something that we people that are in AMR have a lot in common.
Thank you so much. Well, thank you, Karina, Kata, for such an amazing and engaging talk. Manu as well. Thank you for the boo clap. Keep us all on our toes. And thank all of you for attending this month's talk. So going to pass it back to Bonnie. Thank you guys all so much for being here and staying to the end a little bit late. And Bonnie, final remarks. Thumbs up. I think everyone's ready.
My speakers.
They came and left. Be back, Bonnie. We see your hearts. We're already starting to leave. Maybe Bonnie's having some issues with audio and things, but thank you guys all so much for being here, and we'll see you guys next month for another episode talk. Have a great evening.
Thank you. Thank you, Courtney, as well.